what I'm doing here today is kind of in collaboration with freeCE.com. Give them a good plug here. So I worked with them on some technician training material, but they kind of had helped me collaborate a list of questions to kind of that we had seen around some of their material with pharmacy technicians, and as well as kind of what I've seen in the group. So it's kind of a collaborative effort here with freeCE.com. They're awesome. As you guys know, I'm Eric Geyer, and everything seems to look pretty good over here as far as what we're doing and giving vaccines. We're getting back in my store here in a few days. Do want to say thank you guys to the group. A lot of the stuff that we helped put together with freeCE kind of came from stuff in the group, so it was a really good collaborative work with everything you guys threw at me for questions and the like. So again, thank you so much for all that stuff. It's something really cool to kind of make something positive out of this and help get technicians into the workflow to alleviate some of the issues pharmacists have. As you know, we're kind of getting crushed on these front lines with phone calls and everything, misinformation, what have you. So again, thanks. Jackie Boyle, Dan Arendt, just some other people I'm forgetting who are admin in the group, Abby, Sean, Steve for creating it. Everyone, you guys have been awesome to get this going. So I just want to make sure to thank you guys. Again, just so you guys know, freeCE.com, they have a pharmacy technician enhanced training program with immunization specialty certificate. It's pretty awesome. I really like it. Some of the rock stars in the group, like Gretchen Garofoli, helped do it. And she's been featured on the BBC and some other things. I've had her on my podcast, which is nothing compared to the BBC, but she's a rock star down there in West Virginia for pharmacy immunization-based stuff. So I just want to make sure you guys get a good... If you need someone to reach out to with some insane level questions, she's a good person to go to. She's got a big heart, and her husband's also a pharmacist, and so are her parents. So she's like me. She's kind of got that bloodline in it, and pharmacy is what we do and what we care about. Anyway, kind of want to make sure that you guys have some chance to ask questions. So if you have a chance to ask questions, throw them in the comments. That will be something I'm constantly monitoring, just so if you guys do have some, I have some planted ones as well. So one of the things too you guys got to make sure is that if you're a pharmacy technician, you are at least, depending on the state, there's some different rules. Generally speaking, if you're PTCB certified, that's a good way that you can help kind of give out vaccines and help with this kind of end of the pandemic we have going on. That's kind of usually the first step. Some states, like my state, Ohio, you just have to be registered with the state. Other states don't have any restrictions with some of that stuff, but definitely I think you should be probably PTCB certified or have some sort of good training before you just hop into giving a vaccine, since these vaccines aren't exactly like the flu shot. They're not pre-filled. They're not coming with, you don't have to mix them. Some of you do have to mix. So it's a little bit more different and some technicalities with this. So just make sure you guys are doing that. Some of the challenges we're having with COVID vaccine is just the volume. And a lot of people have had questions with that. I've seen a lot of success when there's a pharmacist dedicated to doing it and just make them own it. I know at my store, Kim has been awesome with this when I wasn't there. And we just kind of, usually for that day, it's that person's in charge of it. Unless someone comes in that is related to us or prefers the other one, we kind of make them in charge of it. And usually it's the opening person who's doing it just because they are starting off with it. So if that's for the retail side. For some of the big organizations and the big mass vaccination sites, Dr. Neil Smoller, drneilsmoller.com, he's kind of a friend of mine who's been crushing it out there in New York City, or not New York City, in New York State. And he's been doing an awesome job. He's someone I would definitely reach out if you're doing mass vaccinations. I don't have as much experience with that, but kind of like what we're seeing there and what we're seeing in retail, a lot of it goes in the planning and the setup and make sure you have a system. I don't really want to say anything is better than another system, but a lot of times as long as you get that system and you stick with it and you're consistent, that's key to making sure that you're not making errors or missing time, and you have a plan in place in case you have to get rid of some extra doses, which now in most states should be almost anybody 16 or 18 and up, depending on the criteria. Please check with your state. And as always, anything I say in here is not medical advice. I want to be very clear with that. It's just kind of sharing my opinion, and I want to have a discussion. And again, if you guys want to DM me, that's awesome. You can throw comments on the post as well. So with that, there's some guidelines, and one thing I want to make sure that people understand is with the PrEP Act, we are actually immune from really being sued unless we do anything absolutely egregious. Again, I'm not a lawyer with this, so don't take this as legal advice, but there is some immunity in place. So if someone has a bad reaction to the vaccine, as long as we do everything right, then we're pretty much immune to it. I want to make sure people understand that. And when it comes to pharmacy technicians, you guys are too. That was included in the PrEP Act for HHS. It's a huge thing that some people look at as a way that we're just trying to avoid litigation. That's not it. I think it's just there to help people embrace new ways of getting vaccines to people. in a pandemic, you really need to make sure that you're doing everything just as quickly as possible, also correctly, but quickly as possible so that you're really getting it to people with a best effort. And that's where the good faith effort part really protects everyone. So I'm going to dive in kind of in and out of some questions I got here. One of the questions I have here is, what is known about the administration of COVID vaccines in pregnant and or breastfeeding women and those trying to conceive? Right now, I believe it was ACOG, the American College of Obstetrics and Gynecology, said, give it. Didn't even hesitate. We've seen a lot of OBGYNs who are pregnant themselves give it. They give it to their patients. Me and my wife looked at this, and we are 100% behind it. She's trying to get hers. And this is one of those things that definitely we want to make sure you get. The side effects of COVID are much worse for pregnancy than what we kind of thought, at least what I thought. I was just reading an article by New York Times that said the amount of stillborn babies has increased dramatically in the past year. Now, there's a lot of factors in that, but there's stress on the mom, stress on the baby, stress on everything else. COVID's not going to help that. Catching it's not going to help it either. I don't want to say without diving into it further myself that there's a definitive link there, but when you look at, okay, 2020 was much higher than the year before, what changed? Well, COVID's the elephant in the room, right? COVID's the thing that changed a lot of it. So if people have questions about it, I think that there's plenty of good places you can look at. Again, ACOG, American College of Obstetricians and Gynecologists, if I can say it right, recommend it, and they are totally up for it. There's also with breastfeeding, it looks like antibodies do get put into the breast milk. Now, we all know digestive tracts are what they are, but that could mean that some are getting to the baby. I haven't seen a study out on the baby's response if the mother's vaccinated, but we can assume that there's some there. So that's a really positive sign, because it means hopefully that we can pass this along to those mothers who are breastfeeding, and pass it along, because we all know breastfeeding is a ton of work. It's not easy by any stretch of the imagination. We definitely want to thank everyone out there who was breastfeeding. I know my wife in particular did. And, there's times I felt helpless, but I know that she was doing what was right. And so thanks to her, and thanks to all you breastfeeding moms out there. Not to shame anyone who does it, but I know it's a ton of work you got to put in there. And it's good to see that there's some COVID news for it that's positive. All right, so someone I would like to know which vaccine is more effective and why. Generally speaking, they're all pretty effective when you look at severe infections or hospitalizations. We're hearing a lot of demand at local places for the Johnson & Johnson one. And I think that's two-part. One, it's only one shot. People hate getting shots. I don't like getting them. I still got my two. The second one kicked my butt. But that's something that I think we're getting with that. It also looks like it's pretty good against the South African variants. So that's something that we really, people might be scared about. They want it for that reason, even though it's not as effective against some of the preventing the mild to moderate cases of COVID. So that's something that I do want to make sure that people understand with that. Here's one for another one popped in is, as a pharmacist, people rely on me for information about the vaccine. Even though I've been retired for 3 years, I kept myself informed about the vaccine. However, I've met so many people who refuse to get the vaccine, I cannot convince them otherwise. Do you have any advice as to how to approach these people? This is a great question. I know we're all getting. I know that sometimes, I don't think we're there yet where we're trying to sell the vaccine like we do with flu shots sometimes, but I think it's a question that we just need to build that relationship with them and have the discussion. If you work with me, I have the discussion all the time, especially when I have it, or if I see patients who are, I have to call them like critical access patients. Like if I know they work in the community or they have a voice or they go out. I had a dialysis patient come in who was really not receptive to it. He didn't want to get it, whatever, but I kind of went over some of his meds, and he's kind of a tough patient too, but somehow we had an extra dose and he was just standing there. I'm like, look, you're a dialysis patient. You have chronic kidney disease, obviously. You have diabetes. He was of a minority background. And I'm like, and he's in a low income area. I'm like, you have a lot of risk factors right now that are going around that we need to get you protected. And he kind of talked about it. He saw that I was coming from a genuine spot and then got it. We got him a second dose, and he's out there promoting it to everyone in the dialysis center now where he goes, which is generally a low income center. And I think that's huge because sometimes people see the white coat and they're not going to believe you. They're like, you're part of big pharma, whatever. We all know that's not the case. We all know we have moral compass and a duty to take care of people. So that's something that I think is really important. I think it's key to lean on those people who we can count on in the communities that are hard to reach. I'll shout out Logan Yoho down there in Southern Ohio where it's a little more rural, and he's really doing a good job to get vaccines to people. And there's a lot of hesitancy around there. And he was even reaching out to his governor before they allowed everyone to get it in our state, being like, hey, I need to lower age because I don't want to waste doses. And so we're seeing people take a proactive stance. So Logan, you've been doing great down there. I love seeing it. But that's another thing we can do is once we get this out and more people see it, they'll start seeing someone got it. They didn't grow a third arm. Maybe I should get it too. And so we really got to do the best we can to just win the victories you can. Some of those people you might walk up and they might be a full not believing in vaccines type of person. And you know what? Don't waste your energy on it. We're getting enough brutalized with questions and phone calls and everything else and staffing issues in pharmacy. I think that will mainly due to reimbursement issues, but I think that's something that just pick your fights and have the conversations where you can. And honestly, if a person's not receptive after the first second or two, just back off. I don't want to say don't waste your time, but don't waste your energy. Like maybe if you keep reminding them, like with smoking cessation, we know that the more you remind someone, the more likely they are to quit. So that's something that I kind of take that approach of just kind of chipping away at the iceberg, if you will. Another one here is, what are the most common questions you're hearing for COVID-19 vaccines? Other than if we have it in stock or if we have the Johnson & Johnson one, I'm having a lot of people ask about, hey, if I get another vaccine, what can I do with this one? Like, if I got shingles, can I get this? Or, if I got this other vaccine, can I get this? You generally want to space those apart 2 weeks before, 2 weeks after. So what I kind of tell people is they come in, they want Shingrix, or they want another vaccine. I'm like, hey, let's do COVID, and then let's follow up with your other one. Just because I don't want to delay this when, yeah, shingles is important. Tdap is important, especially if you're a new parent or going to be a new parent. But I think that COVID's going to take the priority because we've got herd immunity to most of the other diseases. Maybe not shingles, but pertussis, we generally have herd immunity due to amazing healthcare system we have. So I think that that's a big thing. You really want to make sure that you're kind of informing them. Let's take care of this one first, and then follow up 2 weeks after your second dose, or if it's Johnson & Johnson, 2 weeks after your first dose, with that series of shots you need. Question here on Facebook. It said, hey, this page is a great resource. Got attention from the outside industry too. Do you have any success stories to share that positively impacted our approach to this pandemic? Yes, there's a lot. In fact, not to get into politics of it, but President Biden did kind of expand which pharmacies can get this as part of the federal rollout program. They did this a while back. I actually believe that might have been under Trump. They rolled that out a little bit to get it to some of the more independent and rural pharmacies that weren't included with the initial rollout wave with the two big chains. And that's been huge. We saw even Vice President Kamala Harris visit a pharmacy to get the shot or give it to, I can't remember if she got it or if someone else got it, but we saw her visit there to help promote it. And I think the big thing we're seeing with success and why, pharmacists are so accessible, one, we're so accessible, but two, we're also very trusted and people know us. So if you see someone who's vaccine hesitant, but they've been coming to you for 20 years getting their diabetes medication and you gave them some good advice along the way, that rapport carries. Because now that, they're not looking at you as just another white coat or as a technician, another person in scrubs. They're looking at you as, hey, I know this person. I talk to them. They know about my dog. They know about my aunt, my uncle. They've lived 3 streets over. And those conversations are really amazing because they just inherently trust you. So even if they're a little hesitant, you've already broke down that initial reflexive wall that they have, and you're really kind of hitting them on a personal level. So I think that that's a good way to win, and that's why pharmacies are key with this, and that's why people I'm going to call them out again, Logan's been doing great down there in Southern Ohio, where there's a lot of hesitancy, and some of those counties are seeing great rates of getting it. So that's really good to see, and I know it's Ohio specific, but it does apply throughout the country since I work in an urban area and he works in a rural area. All right, some of the questions here, kind of if people are sick. If you're sick, probably delay it. I had a little bit of head cold just starting when I got my second one. It kicked my butt really bad. Probably not the smartest move on my part, I'll admit that. But I also want to make sure I got it since I was giving the vaccines in clinics, and I really didn't want to spread it around nursing homes. And at that point, we didn't have some of the data that said one dose is as effective as it actually is now with Pfizer or Moderna. So I want to make sure I was protecting them and myself. So I kind of took one on the chin for everybody there. But a patient asks, if I'm taking antibiotics, do they have to complete their second vaccine? If a patient is currently taking antibiotics and has to complete their second COVID vaccine series, how long to wait for finishing the antibiotics? That's a very specific question, and one I've seen too. Generally speaking, I'd make sure that they're symptom-free or the symptoms are waning away before you're going to give that second COVID shot, just because it will probably, take them down a little bit and take them down a notch, make them not feel so good. And I don't want anyone to think that they got COVID from the COVID shot. That cannot happen. That's something I hear a lot of rumors about. We hear it every year with the flu shot. It's always a good pause and teach moment for many people. I want to make sure everyone, does that when they can. Obviously, if they have any sort of reaction, you want to make sure that they're in good health, so they're not risking, having a worse reaction or something like that. So some of the other questions around storage. There's some guidelines in the group for people. I want to make sure you do that. On the CE today with freeCE, I kind of included some of those in there. When it comes to Pfizer, it can be 6 hours at room temperature after it's mixed, 2 hours unmixed, if I remember correctly. Double check. Anyone can double check me on that, but I'm pretty sure that's how it goes. Moderna, I think, was 6 hours as well. And it's already pre-mixed, so it's not as big of an issue there. Johnson & Johnson is 2 hours, if I remember correctly, from what I just updated the CE on. Going from memory here, don't have my notes right in front of me. But that one can be kept in the refrigerator, so that's a lot easier to deal with. It does have to be used within 6 hours of puncturing the vial. Again, a lot of these are preservative-free. That's one of the issues we're kind of up against, and why there's some timelines with it. And again, preservative-free is good because there's people who are worried about it and now don't have to worry about it. So it's a headache with it, but I'm glad that we can tear down one more resistant barrier that somebody might have with it. And again, Pfizer one can be stored for, I think 5 days it is, up to 5 days. They're looking longer in the fridge once it's thawed out from the deep freeze that has to be kept in. So that's a really good call out for people who have questions with it. One we've seen a lot, and I got this one in here, is what kind of pain relievers can I take? Again, we saw a lot of mixed messages at first with ibuprofen and Tylenol. You're generally okay. I'd recommend not pre-medicating just because we don't want to blunt the response in any fashion. And that's a serious thing that, we don't know what percent it lowers it. We know it's not 100%. So we know that that's good. We don't want to obviously lower it that much. But if we can keep it 1 or 2% higher and you had to deal with a little bit of a headache, that's 1 to 2% further herd immunity, protection for yourself, reduction of having a serious case that you have. So why not do it? I'll take a headache every day versus catching COVID. If you've worked with me, I become a bear when I get headaches. I hate headaches. So hopefully that's something people can appreciate and understand, that if you're getting that response, it means your immune system works. That's a good thing. Another question is, what are the most common type of questions we're hearing? A lot of it is around scheduling. And scheduling is going to change. Like, how do I sign up? I'm 18 years old. Governor just approved it. How do I sign up? It's tough. It varies. Each state does have a specific site. I know if you Google, like, I'm in Ohio COVID sign up, they have promoted it. So there'll be a page that will come up in Google where you can go sign up, and it should link to any number of places that are affiliated with that. I know CVS and Walgreens have their own. A lot of these are done online, so you definitely have to go online to CVS.com, Walgreens.com, Rite Aid.com. I don't want to be biased, so I'm throwing them all out there. And you can sign up that way. Some of them have their own restrictions with it, just because of what they've had to kind of go through with it. So just be respectful of that. Another way is some pharmacies do have sign-up lists. Hot contentious item here. Some don't, some do. Kind of depends on the place and kind of issues they're seeing. We're starting it back up at mine since we're getting doses in again. And it's one of those things that is going to be very dependent. So you're going to want to make sure that, I don't have a problem people reach out, but we're seeing people call around every pharmacy, not even in their zip code in their county and the county next to them, trying to get signed up. So if you have those lists, I don't think it's a bad thing. I think it's a good idea to have an emergency, at least if it's a small list of people who no matter what, will come in and get that vaccine, just because we don't want to waste doses. At my store, we haven't had to waste any from timing out or anything like that. I know several other pharmacists are pretty proud of not having to waste any doses, so that's a thing that we really want to make sure that we're hearing more of that, right? So that people aren't being protected. We're not wasting this because it is government money and taxpayer money funding a lot of this. So if you're like me and you're cheap, you don't want your taxes going down the drain. So try and get those vaccines in arms the best you can. That's just the way I look at it. Another question, I've had this asked too, is if you had a breast cancer or you had a lymph node issue on one arm, it is recommended you use the other arm, I know. Again, I've had people who have had both of them, and they say, hey, I can't get it in either arm. Can I do it in the thigh, or what about the butt? It's going to depend on the training and what your site approves. I have read that you can do it in alternative sites. The skin must be stretched. You have to follow all the other stuff because you have to worry about accidentally giving it subcutaneously instead of not going deep enough. That's something you might want to might want to kind of watch out for with that. You might want to use an 1.5 inch needle instead of an inch needle, which does mean you might get a little more vaccine in there and have more waste just because of what's in the vaccine. So you might have a hard time getting the 6th dose out of some of these vials, or 5th dose, or every possible dose in some cases. Where I know Michael Hogue from APHA said, with good technique and low waste space syringes, they were able to, kind of milk extra vaccines out of almost every vial pretty consistently. All right, here's a question. What advice would you give for lymphoma patients and getting the vaccine? That is tough. Whenever we're talking about people who have immunocompromised situations, we want to make sure they have a full immune response. I have to kind of cover my own here, so you're going to have to talk with your who's treating you for lymphoma. But generally speaking, because of the way the vaccine works, it should be safe to give. I just wondered about if we get some sort of blunted response or we don't get the full response. There will be some response, right? Like we know that. We know there's going to be something. So I'm all for them getting it. I would, when it comes to the ones we have now, they're not live. So even Johnson & Johnson's not live. It's a little, kind of like the flu one. There's a modified adenovirus that carries the DNA in, to get nerdy with it. So it's not live. So you don't have to worry about MMR shots where you can't get that when you're severely immunocompromised. So I would say get it. I'm going to err on the side of getting it. I have heard, my nieces have Crohn's disease, and they were told that they couldn't get the Johnson & Johnson shot. And the reason for it from their provider was they didn't have enough data. But they said that the Pfizer one they knew was fine, so which by default should mean the Moderna one's fine. So they were told to get that. That's just what they were told, and I'm just sharing that secondhand. But my sister's up on their stuff, so I know she's pretty good at it, and that's just what I heard. So I think the mRNA ones are a good option, just because they have a different mechanism that we're not. I won't say we're not used to, but that just works differently. So thank you for that question about lymphoma. Another question that came in here is, I heard someone say that their physician is recommending taking Benadryl 30 minutes prior to getting the COVID vaccine. I have heard that. The only person that I would say I recommended that in is there was somebody who had a lot of allergies and they were allergic. They claimed they were allergic. I didn't see them have a reaction to the flu shot, but they also wanted to make sure they were protected. And so I said, well, I wouldn't recommend that. And then she said, well, I've had these issues. I'm like, okay, well, you've had issues. She took a Benadryl. I don't remember. I think she took an hour before. It might have been 30 minutes. And she had it without any problems. She was good. She said her throat tickled a little bit, but she said that happened both times and she was good. She waited for an hour because I said, hey, wait as long as you want. She waited for an hour with her mask on. She's got more patience than I do. I don't know if I could sit in a chair in a pharmacy waiting area for an hour. So I feel for people. But she was fine with it. So that's just somebody who had a history of allergic reactions. Everyone's going to be different. I wasn't hesitant per se, but I was a little nervous about giving it to her just because, she had reactions before. So it is one of those scary things we do have to deal with. But just as an anecdotal story, first-hand experience, she was good to go. All right, so here's a good question. It's pharmacy nerd specific. Somebody asked, when administering shot 2 from Moderna vaccine, the pharmacist noticed that the needle was not fastened on securely and there was leakage down the patient's arm. The pharmacist knows that a portion went in but was unsure if it was more or less than half the dose. What is the correct protocol here? I would fall back on if you work for a larger company and you're not the independent owner, I would fall back on guidelines. I think all of them have guidelines for that. States also have guidelines for this. This is a tough one. It's my comfort with it is I would think that in 2 weeks we want to follow up with a second dose. And in theory, if you get a good response to that second dose where you kind of feel like junk, we can assume that you had a good response to it. If you don't, and I would assume that you didn't get enough of the first dose and you might need a follow-up. That's not a very black and white answer. I realize that's kind of dealing in the gray area here of what we deal with. That's what my personal recommendation is, but I feel like it's the discretion of the pharmacist there. I will say from personal experience, when you spill a liquid, an ounce turns into a gallon. So sometimes you might see a drop go down someone's arm and think, oh God, was it half the shot? Because we are dealing with like 0.3 and 0.5 mLs. If you're seeing a drop, realistically speaking, you get how many drops of an ml? Like what, 15 to 20? So if you're only seeing a drop or two, you should be good. If you're seeing more than that, that's where I would get concerned. So I think that's a good question. knock on my wood desk here, I haven't had that happen, but that is something that you do want to check the shots before you give them. Some of the syringes we got from the federal government, we kind of had to like tighten the needle on them a little bit. So always double check it before you administer or before you even draw it up. The needle's on there tight, because that caused an issue before with trying to get a vaccine out of a vial, where we only were able to get 5 out, not 6 out the one time, because there was a little spillage with how the pressure of the vaccine when it was mixed with how loose the syringe was. So word to the wise, check your stuff before you use it every time. It's a weird habit that you shouldn't have to check the manufacturer's standards, but this is just a pandemic. Just take that one extra 0.3 of a second, try and tighten the needle on a little bit. So thank you guys for submitting these questions here. Questions that Pete Krekel and Gretchen Garofoli had submitted from previous programs were, what if the second dose of Pfizer and Moderna is administered after the recommended time frame? That is a tough one. We have limited efficacy data on that. 42 days is the max that you want to go from the first. So 6 weeks after the first dose is the general recommended max. So if it's not it is not recommended to restart the series. If the second dose is administered past that, that's again into the pharmacy gray zone that we don't like. And I think that would be really cool to still give it to them. I don't want to necessarily waste it. I would just air that. Let's kind of see what that response looks like. If we give it to you again and you have that solid response, I'm going to think we're good. If you're older, it's hard to tell because they tend not to have the same response that the younger people do. So I think that's a thing we really want to watch with. Somebody did message me here, SWAT. SWAT's an amazing friend of mine, fraternity brother. American College of Asthma, Allergy, and Immunology have recommendations on what a severe reaction is. So thank you, SWAT. Again, the American College of Asthma, Allergy, and Immunology. Good place to look, referencing the Benadryl question we got a little bit ago. So thank you, SWAT. You do a kick butt job down there in North Carolina. Kind of deviating back to something I said earlier. Somebody said, what's different about freeCE pharmacy technician certificate? They have some specialties with it. I don't want to dive in too much, but it looks like that they do have like the general certificate that you can get to immunize. They also have some specialties when it comes to like COVID-19 that are kind of like above and beyond. That's the part I did, just so people know. Gretchen Garofoli did a lot of the immunization part, and I know she's good from personal experience and talking with her and seeing how involved she is. I know she's good. So that's part of the reason why, I was talking about it a little bit on here. Some other questions are, have you experienced any issues with vaccinations, and how can you avoid these in the future? I have not, other than a sore arm and what you expect side effects. I haven't had any. Again, knock on wood, haven't had any severe reactions. I haven't had people get a rash, but it usually went away or it was self-limiting, and we made them wait half an hour. It didn't really go anywhere. They were fine to breathe. They had someone with them in all the cases I remember. So we kind of sent them on their way and just said, hey, let the other person drive if they can, just in case something gets worse. And if it gets worse, go get seen. I've heard no feedback that they did have a reaction. So I think that's a good thing. Kind of watching my time here a little bit because I don't want to spend too much time. I do have to go into work here like a lot of you people. All right, some of the other things I got on here. I'll do one more question unless someone wants to throw in the comments real quick. One of the other questions we got, I haven't worked in pharmacy since 2016. Hopefully you're retired. That's awesome. How do I rectify this and get caught up? From a person in Florida. Let's see here. There's a lot of programs to train. I know APHA has an immunization one if your immunization thing lapsed. I know you have to make sure that you were CPR certified. Red Cross, I believe is the approval program for that. American Heart Association, I think either one works. And again, if you're a technician, the freeCE program is great for that. If you're a tech, but I'm assuming this is a pharmacist from what I've seen. So I think it's important that APHA knows a good program. I'm trying to aim for unbiased organizations that is about 20 credit hours for your CE and you're allowed to immunize. Some states waive some of that, so check in your local state. They might just say, hey, you're a pharmacist, you're good. We've seen them let dentists immunize, and not to knock dentists anyway, that's kind of out of their realm, but we also think that they should know how to handle needles and how to do something IM. So there's a little background noise. I apologize. I have some people at my house here, but yeah, that's a lot of the basic questions I've gotten. Again, the Johnson & Johnson one we're getting a lot of questions about, kind of hard to find. They just had a big mix-up with 15 million doses, had to kind of get wasted because of a snafu at the factory. But again, that's all the more reason why things need to slow down a little bit sometimes so we can be more effective and do our work the right way and not worry about speed. Off my soapbox. But anyway, I think that's something that's pretty cool that, people are actually now caring what vaccine they get. And honestly, if I have anything, I'm going to give it to them. But I'm also going to try and educate them about, hey, this is why we have this one and why I think it works for you. And I'm not trying to sell it, but if you know a place in your area, keep a list of who has it. Like I know the pharmacy across the street from me has Moderna, and I have Pfizer. And I know that one of the big vaccination centers in town also has Johnson & Johnson. People request it. So I think knowing where to find those in your area is key, just because that way you can point someone in the area. Because, I mean, yeah, it's great if I can get paid to give them the shot. That's not what I got in pharmacy for. I mean, I did expect a paycheck out of it, but I didn't get in it to become a multimillionaire. So I want to make sure that everyone understands, like, hey, do what's best for the patient, and that's what's going to help us get to herd immunity, right? Maybe Johnson & Johnson isn't as effective at stopping the mild cases, but it's just as effective at stopping the severe cases. And some of the news that just came out to be cool for everybody is that the it's found so far in a smaller study of about a couple thousand adolescents to be 100% effective in stopping coronavirus symptomatic infections in them. They're looking into asymptomatic. That was a new thing. So we could see by summer we're doing down to 12-year-olds, 10-year-olds, or younger. They are studying it down to 6-month-old babies, since we know that that's when the maternal white blood cells and kind of immune system kind of goes away. So who knows what we could see. I would like a little more training if I'm going to have to stab a 6-month-old with a vaccine. So that's obviously something that could be coming down the line. And this is why having technicians engaged with this type of programs is huge, because, you know, pharmacists get all the glory. Well, okay, we don't get enough glory, but we get all the glory in pharmacy. But pharmacy techs are what make us able to do our job. And so getting them enrolled and kind of upskilling them is huge. And so that's what I think, especially in a pandemic. Now, we might see some of the stuff go away when the pandemic goes away. I don't know. Just a thought. I know some states will probably lag behind. But that's something that we want to get them in now, because we want to get this over with. And if I can have one more, even part-time immunizer, that's huge in helping just take something off my plate so I can have those discussions and know that that's taken care of. Immunizations aren't hard, but, you know, reconstituting and stuff and watching it and keeping that clock in your head and all the other stuff is a little tougher. But that's just something that, you know, we're learning as we go. So got a few other questions here that I'm just going to look at. I know we're ending this real quick, so I'm going to wrap up. Non-polyethylene glycol polysorbate 80 vaccines in development. I'm not sure about that. I can't speak on that at all. I have heard some issues with some of the PEG-related things, but it's pretty rare. I don't want to say poo-poo it, but something to think about, I guess, coming down the road. I haven't seen that, so I can't speak on that. But hey, everybody, I got to go into work. I'm going to get lunch on the way in, so I'll see my team here soon. I think almost all you guys are in the group. I didn't force you in there, but just something that you guys can share this. Hopefully this can help people with understanding some of the things that we see with COVID vaccines, understanding the stress we're in, and maybe throw some common questions out there. Heck, refer patients to this for all I care. I have no problem being the face of this, what we're doing to help get this vaccine into people's arms. So just something you guys can do. That's part of the reason we have the group public, is so people can get good information and share it. I know it has some limiting issues, but if you guys have any questions, DM me, DM the admin. I don't want to put on the spot. I know Jackie Boyle's really good at getting back to people. Sean, I can't ever say your last name right. He's also the clinical specialist, so he's really good at stuff like that. Just feel free to message us. We have no problem with any of that stuff. But anyway, you guys, thanks for listening to me blabber on for 30 minutes. Even though I do my podcast, it's weird sitting here talking to a camera and not having somebody to interact with. But, you know, if you guys want a good reference for pharmacy techs, freeCE.com has some awesome stuff out there. And I'm not going to lie, I helped them do some of it, so I'm a little biased with it. But I know it's quality because I know how much time everyone put in. And I know the people who put in the time were quality too. So, again, if you guys have any questions, hit me up. Throw them in the group. We try and let stuff go. But I just want to try and address some common questions that we kept getting a lot of or saw multiple of, so that I didn't have to bombard the group with stuff and just have one video that's a little more interactive with you guys. So thanks, take care, and stay safe out there, and keep vaccinating people, everyone.